We know that loneliness, living alone and poor social connections are as bad for your health as smoking 15 cigarettes a day. Being isolated leads to poorer health outcomes. It is worse than obesity and can increase the risk of high blood pressure and increased risk of developing other conditions such as heart disease. Locally, data suggests that around 212,000 people are often or always feeling lonely. The percentage varies in each of our Black Country places. Loneliness can affect people differently. Nationally, women often feel lonelier than men, and it is likely to affect older women more. Charities have undergone research with people who use their services, and they tell us that 43% of 17 to 25-year-olds have experienced loneliness, and 50% of disabled people will be lonely on any given day. In this month's Feet on the Street, we hear from people who have felt isolated or lonely and how it affected their physical and mental health. We also ask what more can be done to avoid people becoming lonely and what barriers might prevent them from accessing NHS services.
I feel it every day. Isolated, lonely. And how does this make you feel?
Yeah, definitely. And we've always, with social prescribing, we've always seen a lot of people come through with isolation and loneliness. But typically that used to be more the more elderly population. But what we're seeing now as a result of the cost of living crisis is a lot more people who are of working age coming through who are also feeling very lonely and isolated. So obviously people are having to cut out social activities, seeing friends, they're having to prioritise where they spend their money. So we're kind of seeing social isolation and loneliness in the physical sense, but also in terms of people's self-worth as well, and generally just that kind of lack of meaning and purpose.
One of the things that I feel people should be encouraged to do is to try and start cooperative housing. Now, they have that in other countries. That's where groups of people build their own, well, not doing the bricklaying and putting on tiles, but have their own centre built and owned and run by the people who live in them. And if someone needs help in nursing or something like that, they would obviously get NHS support.
So there's been a lot of funding over the recent years into more kind of social prescribing link worker roles and other personalised care roles, but not the same amount of funding's been invested into the voluntary and community sector to invest in these kinds of activities that do wonders for people's health and well-being. So I think that's really something that the NHS should give more thought to as well going forward. And it's that kind of age-old saying, I've heard it a few times now, but the danger of too many travel agents and not enough holidays.
Well, I used to have some calls, but when I couldn't see it because my ears had been bad, we just put the phone down. I apologise to say I can't see it. And the phone was there.
when people want to see a GP and they want to talk to somebody face to face. I think is part of that feeling of community which is here and still thriving, but it needs to be nurtured and supported by systems and services, I think.
I always take Julie with me, then she knows if I can't hear something that she's heard it.
And what does Julie do for you?
Julie, she comes once a week and we go to the shops, we do the shopping and get some relief from where I've got to get it from. And then we come up to the school for half an hour or so, don't we? And I look forward to this on a Wednesday.
So if Julie didn't take you, how else would you be able to get to your
I
pub?
wouldn't go, I'd refuse. I'd refuse everywhere where I should go, I'd refuse it because I don't want to go in a taxi. No way. I want to be independent.
So, what is the impact on health and social care use? We know from research that lonely people are more likely to rely on the use of our health and social care services, with increased emergency admissions, more demand for GP appointments, and increased risk of care home admissions. Factoring all of this in, there is a need for us to recognise the importance of interventions that reduce loneliness in the Black Country.